Ms. Kuster, you are now recognized.
Thank you, Mr. Chair, and thank you, Mr. Hardie, for your service, and Dr. White for your research, and to the whole panel for being with us today. I'm just thinking of my own personal experience, not in wartime, but I had an illness that was connected with ingestion of volcanic ash, and I was very sick for a very long time. And so my empathy is with you and the veterans in terms of a substance like that you don't, I learned later that that's really ground glass, and when it gets into your lungs, you do get sick. But it was that same feeling of the cloud coming toward you, and the helplessness of, not being able to protect yourself. So my goal here is twofold. One is to make sure that we have a sufficient understanding to help the veterans from the Gulf War era. And number two, and equally importantly for me, that we have an understanding to protect our service members who are currently serving abroad. And so my question, and I've just put this out to Mr. Hardie and Dr. White, but if anyone else wants to weigh in, have we, I understand your frustration, and I'm just wondering, have we made any progress? Are there individual instances, are there anecdotal stories of treatments that have been effective that could be more widely used? Let's start with that.
Maybe if I will first, and then Dr. White will have probably other things to add as well. But so there is hope through the efforts of many here in this room, including, thank you, Dr. Rowe and Mr. Walls, for your leadership with the congressionally directed medical research program, and for many of you who have signed on in support of that program. It was created in FY 2006 and has shown great progress, but again, outside of and in spite of the VA. Which is now doing some good things, thanks to the work of Dr. Kalasinski, but has a long, long, long ways to go. About a third of the studies funded through the program are testing actual treatments that might help the health and lives of ill Gulf War veterans. The other 2/3 are studies that are aimed at Gulf War illness's underlying mechanisms. They include critically important animal studies that test exposures and measure health outcomes. Again, the kinds of things that are now threatened by this IOM report. They identify treatment targets. They test treatments. There are three that have three treatments. Again, much of this is still in the pipeline, but there are three that have been shown to be effective in limited numbers as well. Coenzyme Q10, carnosine, and acupuncture for pain. I take CoQ10 every day. It helps me a great deal. It's not a cure, but it certainly makes a difference. I've heard the same from other Gulf War veterans. I'm pleased to hear that now we have this study coming from that will advance it. But again, it's not a cure. I take it every day, and I can tell you that but we're making the progress now through this program, and we hope that VA would finally get on board with making the systemic changes that need to happen, including in its badly broken Office of Public Health.
So one of the things we're going to be doing a regional hearing of this subcommittee, actually coming to New Hampshire to talk about opiate use and some interesting research that's going on in White River Junction, VA, to bring down the use of opiates using alternative remedies, acupuncture, mindfulness, some of the things that you've mentioned. Because I do believe in that mind-body connection, and I don't mean to diminish anything about it. I know that there are certainly illnesses, thyroid illnesses, that type of thing, where it is so closely connected. So I think it's worth exploring these other treatments, and I guess, and because I agree with you that just throwing pills at it, throwing psychotropic medication that have these downsides with certainly suicidal ideation, et cetera. But just going forward, I'd love to talk with you all about, we're going to be looking hopefully at legislation about best practices in the VA on pain management. Maybe there's a way to bring in some of this research that has gone forward. And just, Dr. White, I have a very brief time left, but if you have any comment.
I would say that There's a number of lines of treatment approaches that have been supported by CDMRP and more recently VA through our recommendations and work with them on the Research Advisory Committee. Some are aimed at symptoms, brain activation, improving general health and well-being. Obviously, when chemicals affect the brain, they affect how you feel as well as how you think and your immune system, and it is a whole body thing. I think what we're trying to say is that there is physical damage to the brain that is causing emotional as well as cognitive and other symptoms, and you need to approach the whole package. One thing that I think is really wonderful about the support we've gotten for the CDMRP programs, and I'm on the integration panel for that, is that we are now working on therapies and trying to fund therapies that get to the neuroinflammatory and mitochondrial basis of this disease. If we can find treatments that go after the neuroinflammation, that go after the mitochondrial damage, that go after some of the mechanistic underlying pathophysiology of this illness, we will not only help the Gulf War veterans, we'll help other people with exposures in the whole world.
Right.
And these kinds of chemical exposures are very hard to treat, as you know from your own illness. So I think that there's so much promise in the mechanistic-based treatment, as well as the symptomatically focused treatment. I would hate to see that lost. We're finally getting to mechanism, and we were not anywhere close to that 10 years ago.
Yeah, no, I need to yield back, but I agree, and the other half of my question, we won't get into it here, but I am extremely concerned that we get upstream on understanding the exposure, because obviously, you know, I don't have to tell my colleagues that war is a dirty business, but at least we can do our best to protect our troops from smoke and inhalation and that toxic exposures. So thank you, Mr. Chair, for your indulgence.
Thank you, Ranking Member Kuster.